Information around the orthopedic program. Hopefully, you're in the right room. If not, feel free to join another breakout room. All right. And then Kathy, if you want to introduce yourself.
Yeah, hi everyone. So my name is Kathy Huang. I'm the program coordinator for our orthopedic physical therapy residency program. And I'm also teaching the didactic courses. I'm one of the mentors. So I'm like with you guys or with the residents throughout the whole year. Thanks for joining.
All right. So our program is 12 months long, and then our residents start in September. We are fully accredited and reaccredited, so we're set to go for many years. Um, so for those of you that are not familiar with San Francisco, our residency is primarily based at the UCSF Mission Bay campus. So that's on the east side of the peninsula, right next to Oracle Park, where the Giants play, and then just a couple blocks away, actually, from the Chase Center, where the Warriors play. So if you're trying to orient where that might be in your mind, that is where, and our residents are at our 1500 Owens building, and that's where their mentoring will take place. So, and our mentoring is all one-to-one, and it's 4 hours a week. Our residents do teach in the DPT program. It's approximately 4 hours a week, but obviously there's some weeks that there's no class or there's breaks. And there might be some weeks when two residents are teaching and the other two get the week off. So there's some alternating there, but it averages to about 4 hours per week over the year. And then we also offer weekly didactic instruction as well. What I will say does set our program apart from some, and you do want to ask this question when you're looking at residency programs. Our didactic time is built into the like average 40-hour work week. There are many programs out there where you are going to work 40 hours of patient care, and then you are going to do hours of didactic time on top of that 40 hours of patient care. So just bear in mind what that's going to look like on a week-to-week schedule for you and what's your best method of learning and resting and work-life balance. So it equates to anywhere from 23 to 35 hours of patient care per week. So it's on the lower end in the first couple trimesters of our residency program because that's where our didactics are heavily positioned, and then more like 35 hours of patient care per week in the last trimester when the didactic materials and tests have all wrapped up for the most part. This is just a sample of what a weekly schedule looks like for our residents. Our residents do work a Tuesday through Saturday schedule. So you can see there might be teaching. This is teaching an orthopedic course at SFSU, for example. Our residents do help in two orthopedics courses, one in the first year, one in the second year with our DPT learners. And then lunch commute time, and then would do patient care, for example. And you can see mentoring built into the week. And again, didactics also built into the 40-hour week. Each Thursday, our clinics have something exciting from 12:30 to 1:30. Once a month, it's journal clubs, which are actually led by our residents. Or it could be an in-service, and if it's not a topic of interest to our residents, they might do an independent study hour there. Or it could be a clinic meeting where you just hear the goings on of what's new in the clinic and things to look forward to. I will say that occasionally we do have some things on Mondays. Twice a year, our residents present at the Orthopedic Institute rounds where they will join surgeons, residents, fellows, as well as sports medicine specialists and present a topic tying together PT and physicians and orthopedics. And I think we might end up, it's about two classes a year might fall for half a day on a Monday or a full day, but we usually will move around the schedule to accommodate when that happens. Just to get an idea of who our faculty is, we're 17 orthopedic clinical specialists. We have two sports clinical specialists. Four of our faculty are fellows of the American Academy of Orthopedic Manual Physical Therapists. 10 of our faculty have also completed orthopedic residencies and fellowships themselves, so they understand who our residents are and can see when to push and when to maybe pull back a bit. So I think it's helpful to have somebody that understands this journey. And then 14 of our faculty members do teach concurrently in the UCSF SFSU graduate DPT programs. So some folks love that number. Some people are like, oh, I already have met some of these people. But so it's not all of our faculty, but it's a big chunk. Other things to look forward to, we do have partnerships with physicians that are in that Orthopedic Institute, as you heard me mention, for the rounds that they will do together. And then our residents will actually go down into the Orthopedic Institute and do observations there, just to see how they handle things from a sports medicine ortho point of view. And then for our temporomandibular joint and orofacial pain, we actually have our dental experts at UCSF teach this content, one of which actually started out as a physical therapist and is now a dentist. So some really unique expertise there. As far as other observations go, within the same building that our ortho residents spend their time in is where our UCSF hand therapy clinic is. So our residents get to do a rotation there. If it is of interest, this isn't something we force upon everybody, but they're able to go and watch an orthopedic surgery, which is pretty cool, also in the same building, just downstairs. And then one of our slightly newer clinics, but this one receiving a lot of positive reviews. We do have a psychologically informed PT clinic, which is ran by one of our ortho residency faculty, as well as a pain psychologist. So it's just a really cool clinic to see what interprofessional care looks like for those dealing with more chronic pain. So some other unique features at UCSF, I think all residencies are hoping that you'll pass their specialty exams, so pass the OCS exam. But we also are hoping to produce really great educators, and that can vary for each person. Some people just want to be great clinical educators, be an amazing CI in the future, if not already. Or for some, it might be because you have aspirations of being faculty in the future. So our residents serve as lab instructors, like I mentioned, for these two orthopedic courses in the DPT curriculum, as well as for the very first term of neuromusculoskeletal anatomy, which is really fun. It's getting the brand new PT students. I'm sure you can think back to when that might have been you. Um, and then our residents do get formal feedback from both the students and the course director. So you can imagine how useful that is. You're not just getting feedback in passing, but you actually get written down feedback about how the learners or the course director felt you did with either lab instruction or after a lecture, et cetera. We don't just throw our residents into the wolves. We actually do have a preparatory course. You'll see it on the didactics list where you get to learn about teaching basics. So you get to have some strategies and things to implement and use before you head into the classroom. We also have our residents serve as CIs for integrated clinical experience. For those that may not have had those in their program, those integrated clinical experiences are just one-day experiences kind of integrated within the academic term. And as again, another large institutional benefit is there are lots of offerings for teaching enhancement. And that can be whether a clinical educator or working with small groups. So there's different offerings for free here at UCSF on just how to get better in environments that you are really interested in as an instructor. And then you'll see that in the list of core competencies for all residents in the nation, doesn't matter which program you're in, we really hope that our physical therapists are practicing systems-based practice. But I would like to say that I think this is a huge area of strength for us at UCSF in just instruction on high-value care. What is that? What can we do to offer best services and practice to our patients? We have an orthopedic dashboard that our residents have access to where they can compare and contrast things like how are their patients doing on outcome measures, and it'll show that on the dashboard. How many visits are they doing for patients with low back pain versus other clinicians that have been practicing longer? So they can kind of see, are they doing too many visits, too little visits, and kind of just gives them fingers on a pulse of how their practice is in comparison to others. And then we also have an area looking at for those that fall off a caseload. Are there any trends for that? Was it because they were insured by Medi-Cal, for example, or Medicaid, I guess for those of you not in California, or was it because they were a certain demographic of people? And so the resident can work with their mentor to really figure out best strategies to really resonate with all the populations that we serve at UCSF. So, in our many years of running now, we realize that maybe not everybody has the exact same set of goals in a residency program. I think when people apply, they know they want to be an orthopedic specialist, but they might have more research interests, or they might have been on the fence about whether to do orthopedics or sports. Or they really want to teach, or maybe they really don't want to teach. And so we came up with sort of a choose your own adventure scenario where beyond the required didactics, training, mentoring, et cetera, that every resident of ours will get, you can choose an emphasis during your year with us. So the research emphasis, for example, we will block off additional time in a resident schedule to complete a quality improvement project. So start disseminating a higher level of evidence, and then a lot of assistance to then seek presentation at a conference or actually publish a manuscript. And we've oftentimes, for residents that have gone down this track, they've done both. So there's some nice recognition there, and something that lives on your CV forever, if you wanted to. And then the sports emphasis, we have certain courses that are actually shared with the UCSF Benioff Children's Hospital Sports Residency. So their resident joins us for several classes, and they welcome our residents to also join them. All of our residents get to join in at least one course, but if sports is of an interest to you and you want to choose the sports track, you get to join for other courses that maybe are areas of interest for you. Maybe it's treating the dancer, working with the female athlete, or maybe it's even more on like what does concussion screening look like on a field or on the court. So that's opportunities there. And then, of course, for journal club topics and case reports, you can choose an ortho sports emphasis there as well. And then our most popular route is the teaching emphasis. I think, we're at UCSF, so folks are usually coming to us because they are interested in being in the classroom. So if choosing the teaching opportunity, residents get to spend more time in the anatomy lab with the students, and they also get to give an anatomy lecture just by themselves. They don't have to do it as a team effort. And then one of the, I think, most educational experiences beyond lecturing is how to set up a practical exam for anatomy. So our residents that choose a teaching route also help set up anatomy practicals. I will say if you're deterred by the fact that our programs do have tuition, our tuition is $3,000. I strongly encourage you to apply once accepted to our tuition scholarship opportunities. We've been very fortunate in past years to offer this, and it covers almost the entire tuition. So at least last year, the scholarship was $2,500 of the $3,000. So do know that that's out there if that was something you're worried about. Given I think a lot of folks are coming with some loans after DPT programs and whatnot. So there are opportunities to make the orthopedic residency at UCSF more affordable. All right, this is our didactic module list. I think most programs that you'll see will have everything in the white font. They may or may not have something in the yellow font, so that's why I highlighted it differently. Here's that introduction to teaching basics. We have that introduction to case report and QI project, pain science and chronic pain management. That one's a fun one. We actually get all of our residents together across all programs, and sports joins us for that one as well. Pelvic health for the orthopedic provider. One of my favorites, the Advanced Anatomy Lab for Neurodynamics. We actually get to get an ultrasound and we look at structures like the rotator cuff muscles, plantar fascia, Achilles tendon. Sometimes we find injuries on whoever's in the class and wants to see what it looks like on ultrasound. We trace nerve pathways down the arm. And then after doing that, we head into the donor lab with the cadavers and find different areas where nerves can be entrapped and really review the anatomy of why certain patients might present how they do. Concepts in vestibular rehab and concussion management for the ortho provider, advanced radiology, which are just some really nice small group seminars with one of our faculty, just really honing in and really kind of going above and beyond what most DPT programs do with radiology. And then finally, our UCSF running course. And by popular demand, we've actually moved this one into the first trimester earlier because a lot of our residents are seeing runners in our clinics. So pretty well received and gives out some good information. All right. You don't have to write down these numbers. They are on our website. But we do have a 100% pass rate on our OCS exam to date. We're very proud of that. Our residents work very hard after they graduate to keep this stat high. We do have a 100% retention rate of residents enrolled in the program. And then once our residents graduate, we've actually been able to hire 77% of our graduates to UCSF, and those are predominantly two faculty positions. So again, faculty something you're interested, or maybe not, maybe you just want a health position. There's lots of opportunities, generally speaking, to stay in the Bay Area if you're interested. Save the date, March 14th, 2026. It is a Saturday is when we will be doing our interviews. So if you plan on submitting an application, go ahead and save the date there. And if you get invited, we'd love to see you on March 14th. Just a little preview as to what interview day looks like. We are divided into two panels, 30 minutes with each panel. And the first one is a very typical interview where you sit down and answer questions and meet several of our faculty there. And then the second panel is a case. So it's a clinical interview and you're given a patient case. You kind of treat it as if it's telehealth because it's all of our interviews are over Zoom. So you don't have to pay to come to the area if you're not already here, or if you're doing something else, leaving clinic or whatnot, you don't have to worry about that. We hopefully make it accessible by having Zoom interviews there. And then we also have a current resident that will do a Q&A with our applicants there for interview day. And Kathy and I are not there for that. So you can really ask them like the nitty-gritty of the day-to-day life of a resident without thinking that you're going to be scored on it or something. So you get some good information there as well. I will let Kathy introduce our residency alum, and then I also want to welcome people to put questions in as well that we can answer, whether the questions are for Kathy and I or if you actually want to ask our recent residency alumnus.